All right. Then the third and the fourth parts of the questions, I'm going to blend them together in one video, okay? And that is basically, is there accelerated form of low frequency TMS? And the answer is yes. You could do, I'm talking about low frequency, I'm not talking about theta burst stimulation anymore. I'm talking about low frequency 1 Hertz stimulation on the right DLPFC, doing that for about 8 times a day for 5 days for a total of 40 treatment sessions. A Canadian paper, let me see if I can pull it up on your screen, just 1 second. Okay. Okay, I think this is the paper. Okay, all right. So basically, what they tried to do is that they used the low frequency TMS 900 pulses per treatment session, and I think 600 pulses per treatment session, and they did that for 8 times a day, and they did that for 5 days, meaning 40 treatment sessions, and they had positive results. The study was for depression, though. It wasn't for anxiety, right? Remember when I told you about like the high frequency the activation of the left hemisphere to treat depression, or inhibition of the right DLPFC to treat depression? So they use that principle of let's inhibit the right DLPFC by using 1 Hertz TMS to kind of lower the activities from the right DLPFC. Okay, all right. And that would take me to the rest of the question, which is this machine is going to be cheaper to build and it will have much less risk of seizure. So, okay, so that tells me that you're probably aware of that Canadian trial, and their discussion in that paper, why did they want to do this, is because they were thinking that maybe we can make this home machine, so if I have a device that is not going to require that much cooling, because the main issue with why we need cooling when we're doing high frequency TMS is when you're delivering those pulses, so frequently in a very short period of time, that creates a lot of heat. Okay, well, if you're doing low frequency, which was 1 Hertz, meaning 1 pulse every second, you have enough time in between the pulses to cool down the coil, right? But when you're doing 40 pulses in 4 seconds, that is so much heat being produced that you would need active cooling system. So the machine will have, either air cooling or liquid cooling to kind of cool down the coil, okay? So if I need to use low frequency TMS, I don't really need cooling system, just like passive cooling would be sufficient. So in this situation, yes, it could be cheaper to make the device, okay, the TMS device. So, I don't know, like, let's say, it's $80,000 to make, a full device, for high frequency TMS. Maybe half of this amount, maybe $40,000 would be enough to make low frequency TMS device. Here is the trick, though. To the patient, who's gonna buy a machine for $40,000 to do, right-sided TMS when they can go to a TMS clinic next door and do it for $6,000, $7,000, right? I don't see the multiple use kind of thing, except if we're leasing that machine, from one patient to the next patient to the next patient, similar. But even that is similar. Like, I was thinking about like CPAP machines for sleep apnea or what have you and stuff like that. But even that, it would be kind of less practical than that aspect. Anyways. Is there less risk of seizure? In theory, yes. So in theory, low frequency TMS has less excitability of the brain tissue, so it has less risk of seizure. But again, if we're giving that machine to a patient to do at home, they could stimulate the wrong area, and that could result in seizure. So I'm not really sold on the safety of doing TMS at home, okay? And since we're talking about this, I just want to clarify that this is not TDCS. This is not transdermal current stimulation, okay? This is not Fisher-Wallace kind of thing that, is sold as at-home TMS device. There is no TMS device at home. That is not a TMS device. That is a transdermal current stimulation. It's completely different than TMS. It's very weak in the amount of stimulation to the brain, and the evidence for depression with TDCS is basically for mild to moderate depression, and the effect size was very low. It's not for severe depression. It's not for TRD, okay? So it's only TMS that is for severe depression, that is TRD. Okay. Disclaimer: although I am a psychiatrist, this is not a professional advice, as I am not familiar with the specifics of your unique situation. Please contact a psychiatrist in your area with more questions. This disclaimer is added to my answers on social media after consulting with the American Psychiatric Association. Thank you.